What to know about monkeypox? Here we are, well into year 3 of the COVID-19 pandemic, and now we're having an outbreak of monkeypox. Is this a new virus? How worried should we be? While new information will continue to come in, here are answers to several common questions.
What is monkeypox?
Monkeypox is an infection caused by a virus in the same family as smallpox. Monkeypox is commonly found in Central and West Africa, where there are tropical rainforests, and where animals like certain squirrels and rats that may carry the virus typically live.
Why is this disease called monkeypox?
The disease is called monkeypox because it was first identified in colonies of monkeys kept for research in 1958. It was only later detected in humans in 1970. It is a viral zoonotic disease, meaning that it can spread from animals to people. It can likewise spread between individuals.
What are the symptoms of monkeypox?
Symptoms of monkeypox normally incorporate a fever, intense headache, muscle aches, back pain, low energy, swollen lymph nodes, and a skin rash or lesions. The rash normally starts within 1 to 3 days of the start of a fever. Lesions can be flat or slightly raised, filled with clear or yellowish fluid, and can then crust, dry up and fall off. The number of lesions on one person can range from a few to several thousand. The rash tends to be focused on the face, palms of the hands, and soles of the feet. They can also be found on the mouth, private parts, and eyes. Symptoms typically last between 2 to 4 weeks, disappear all alone without treatment. If you think you have symptoms that could be monkeypox, seek advice from your healthcare provider. Let them know if you have had close contact with somebody who has suspected or confirmed monkeypox.
Can people die from monkeypox?
Most of the time, the symptoms of monkeypox disappear on their own within a few weeks. However, in certain people, they can lead to medical complications and even death. Newborns, children, and people with underlying immune deficiencies may be at risk of more serious symptoms and death from monkeypox. Complications from severe cases of monkeypox include skin diseases, pneumonia, confusion, and eye infections, which can lead to loss of vision.
How does monkeypox spread from animals to humans?
Monkeypox can spread to individuals when they come into physical contact with an infected animal. Animal hosts include rodents and primates. The risk of getting monkeypox from animals can be reduced by avoiding unprotected contact with wild animals, especially those that are sick or dead.
How does monkeypox spread from one individual to another?
People with monkeypox are infectious while they have symptoms. You can catch monkeypox through close physical contact with somebody who has symptoms. The rash, bodily fluids, and scabs are particularly infectious. Clothing, bedding, towels, or objects like eating utensils that have been contaminated with the virus from contact with an infected person can also infect others.
How can I protect myself and others against monkeypox?
You can reduce your risk by limiting contact with people who have suspected or confirmed monkeypox. If you do need to have physical contact with someone who has monkeypox because you are a health worker or live together, encourage the infected person to self-isolate and cover any skin lesion if they can. When you are physically close to them, they should wear a medical mask, especially if they are coughing or have lesions in their mouth. You should wear one also. Avoid skin-to-skin contact whenever possible, and use disposable gloves if you have any direct contact with lesions. Wear a mask when handling any clothes or bedding if the person cannot do it themselves. Regularly clean your hands with soap and water or an alcohol-based hand rub, especially after contact with the person who is infected, their clothes, bed sheets, towels, and other items or surfaces they have touched or that might have come into contact with their rash or respiratory secretions. Wash the person's clothes, towels, and bed sheets and eating utensils with warm water and detergent. Clean and disinfect any contaminated surfaces and dispose of contaminated waste appropriately.
Can children get monkeypox?
Children are typically more prone to have severe symptoms than adolescents and adults. The virus can also be passed to a fetus or to a newborn through birth or early physical contact.
What should I do if I think I may have monkeypox?
If you think you have symptoms or have been a close contact of someone with monkeypox, contact your health worker for advice, testing, and medical care. If possible, self-isolate and avoid close contact with others.
Is there a vaccine against monkeypox?
There are several vaccines available for prevention of smallpox that also provide some protection against monkeypox. Vaccination against smallpox has been proven to be 85% effective in preventing monkeypox.
Is there a treatment for monkeypox?
Monkeypox symptoms often resolve on their own without the need for treatment. So monkeypox is no joke, and researchers are hard at work to answer these questions. Stay tuned as we learn more. If you liked this video, don't forget, give us a thumbs up and click subscribe to join us in Healthifying Life.